Hello, my name is Dr. Gerald Chodak. In this video, I want to talk about using external beam radiation to treat intermediate risk prostate cancer or high risk prostate cancer. Those are cancers that have a PSA greater than 10 or a Gleason score of 7 or higher. And studies have shown that using external beam radiation still allows some moderate amount of men to fail their disease. So there has been a prospective randomized study that was done looking at whether or not there would be an added benefit to doing hormone therapy along with external radiation therapy. Now, the external radiation that was given in this study used only a total dose of 70 gray. And many people would argue, well, 70 gray probably isn't enough anyway. So maybe the reason this study turned out to be positive is because the radiation dose was too low. But the study did give the following. It gave 6 months of combined hormone blockade. That means there was an injection of an LHRH agonist and there was a pill used to block the hormones coming from the adrenal gland. And the combination we called combined or maximum androgen blockade. That hormone therapy was given for 2 months before, 2 months during, and 2 months after the radiation was completed. And the men did receive conformal therapy using a total dose of 70 gray. And the results showed a significant improvement in survival and a reduction in recurrence rate. So there's important outcomes that resulted from this combination. And so the question then becomes, if you are now a patient faced with intermediate risk prostate cancer or high risk prostate cancer, and you're deciding on getting radiation therapy, the real question is, should it be combined with hormone therapy? Now, we're not going to have any new information available anytime soon that says, what happens if you try the hormone therapy with higher doses of external radiation? Maybe you wouldn't get the same kind of benefit. We're not going to have that answer anytime soon. So if you're faced with a tumor that is in this intermediate to high risk grade and you're going to go with radiation, you need to have a good conversation with your doctor about the pros and cons of getting the hormone therapy in addition to the radiation, even though you're going to get higher than the 70 gray that were used in the past. The side effects, well, there were side effects associated with getting hormone therapy, hot flashes, decreased sex drive. But in most of the men, the side effects disappeared as time went on when their testosterone level came back to normal. So those side effects, well, there are more of them in the men getting the combination treatment. Those side effects, for the most part, will disappear. What about the side effects of impotence and incontinence and bowel problems? Well, those occur to the same extent in both groups of patients. And we now know that even using higher doses of radiation still doesn't significantly increase those side effect numbers. So the real question is going to come down to the following, that if you're faced with a situation, how do you make a decision and what should be done? I think all we can say at the moment is that if you're going to get the external radiation using photons and they're going to do IMRT or 3D therapy, even if they give you a higher dose of radiation, is it worth considering the use of hormone therapy along with the radiation? The answer is yes. It's just hard to say for sure that if you get a higher dose of radiation that you need the hormone therapy. Many men may say, well, look, I know it's going to take a long time to figure this out. I would rather err on the side of getting the most therapy I can, and given this study that exists, it seems a reasonable option to add in the hormone therapy at the higher dose of radiation. But that is going to be a controversy for some time. Nevertheless, it is a significant improvement in our understanding of the disease and a growing recognition that combination therapy of hormones plus radiation can be helpful in men with more advanced prostate cancer. Hopefully you'll find this information useful as you weigh your various options. Thank you.